Welcome to the Increased Work of Breathing Treatment Narrated Lecture. The aim of this session is to look at treatments for increased work of breathing and the rationale behind these, as well as the supporting evidence. We are going to focus on treatments to improve respiratory muscle function, treatments to improve breathing pattern, treatments to decrease dynamic hyperinflation, education to prevent loss of control, mechanical interventions, and acute versus chronic use of treatments. This table provides an overview of the treatments that we are going to be covering. We're going to be looking at treatments to improve respiratory muscle function, including positioning and respiratory muscle training, to improve your breathing pattern, so breathing control and rectangular or square breathing, to decrease dynamic hyperinflation, relaxation and pursed lip breathing, educational strategies to improve loss of control of breathing include pacing, blow as you go and energy conservation, and mechanical interventions such as fan therapy and non-invasive ventilation. Pulmonary rehab is an overarching theme which runs throughout this. However, please refer to the decreased exercise tolerance section of the GCU Learn website for more detailed information on this. For the majority of treatments, you will see that we have provided the level of evidence. This is taken from the guidelines from the physiotherapy management of the adult medical spontaneously breathing patient. The full guideline is available on GCU Learn. For your information, you will see what the levels of evidence and grades of recommendations mean. Please take a moment and look over this slide.